With us tonight, former Senator Bob McKnight. Thank you for being here.
Thank you, Ann.
All right, so Senator, tonight, U.S. House of Representatives expected to vote on repealing the health care law.
Yes.
So even if that chamber approves this, what about the Senate?
The Senate has indicated they would not take the bill up. And actually on the House side, very unusual, you normally, especially a bill of this magnitude, would have a number of different committees to hear it. The Senate, under their rule structure, has to have those committees. So they've indicated they're not going to take it up. It's not going to be agended in any committee. But even if it did pass, even if it passed both the Senate and House, it would then go to the President. And unless some very unusual and surprising changes came out, there's no chance the President would sign it. So I think you could probably say this is an exercise largely a function of the campaign. A lot of people made promises. The very first vote I'm going to cast is to repeal the health care bill, and they're honoring that commitment.
A case of political theater, perhaps?
Yeah, I think that would be fair. But on the other hand, there are a lot of Republicans. I know you just recently interviewed our own Congressman Sutherland. He's a good example. He was one that if he didn't run on the issue of repealing the health care bill, it certainly was a vital part of his campaign. So a lot of these people really feel, I want to express my very strong objection to this. It does, however, give them a chance now. The strategy the Republicans have announced is, after they lose this vote today, they are going to work on the appropriations bill, and they can do that. They can deny funding for certain parts of this bill. That can pass, and President Obama's got a lot of work to do with these people.
Okay, so not a complete waste of valuable time then?
No, I don't think so. I think the debate is healthy. It's my understanding that even the Democrats have said, you know, we want to talk about this issue too. An interesting point, though, Ann, is if they were really serious, if the Republicans really wanted to get at this bill, they would pull it apart into its components. That's a bad strategy because the components include some very popular provisions, like preconditions, pre-existing conditions, like if you have children less than 26 years old, mandated coverage for them. Being able to, if you got sick, being able to terminate your coverage. So the Republicans are not addressing each of those separate issues because they don't want to vote against popular issues like that. But I do think the debate is healthy. I think there's still a fervor about, you know, I'm really resentful that the government's making me buy private insurance.
Okay, well, we will, of course, continue to follow the debate happening tonight and expect to have more on the newscasts. All right, Senator, thank you so much.
Thank you.